Hey everyone, welcome to Inspirations Med Spa. My name is Stacy Childs. We're going to do a quick tour here and a little Q&A today. So thanks for joining us. Here we go. Coming on in. Here we see Allison. She's always smiling when she come in the door. Hey Al. And then, we've got some staff hanging out here. And Heather. Hello Heather.
Hi, Stacy. Welcome to Inspirations Med Spa.
Thanks.
I am Heather. I am one of the injectors here. I'm a nurse practitioner. So I'm excited to tell everybody about all the neurotoxins and PRF and things we offer. We carry all 4 neurotoxins here at Inspirations Med Spa. So when you come in for your new patient consult, you'll be seeing me. And we can talk about what it is that you want, and then we can discuss how the different neurotoxins work and which one would be best for you as an individual. We also offer PRF here. PRF is a little different than PRP, which is more commonly known. PRF basically has fibrin, which is your own growth factors. And so we can inject that under your eyes to help with under eye circles. We can also microneedle it into your face, and what happens is it helps to stimulate your own collagen and elastin to improve your skin texture and to help get rid of those under eye circles. So I'm happy to talk more about that, and if you have any questions, you come in and see me for a consult.
Awesome. How many units is a typical person going to get with neurotoxin?
It depends where you're going to get it, but a lot of people do what we call the look of 3 or 3 common areas. And so that's the forehead, between the lines, or the commonly known 11s, and then the crow's feet on the outside of your eyes. And so standard dosing there is about 64 units. Now sometimes it's a little less depending on how bad the wrinkles are, how deep they are, the size of your face, your forehead, how much movement you have in those muscles. Sometimes men need a little bit more, so it just depends on each individual. That's why you come in for the consult. We can talk about it, look things over, and then go from there.
Awesome.
Yeah.
And you were talking about the PRF.
Yes, ma'am.
The platelet-rich fibrin. And that is like the big sister of PRP?
That is correct.
All right. And that is because it's got the growth factors, correct?
Yes, and they're your own growth factors. So you have to remember this is a very natural way to improve the texture of your face and to stimulate collagen because we draw your own blood and then we can microneedle that back into your face, your own fibrin from your body. And so it's nothing artificial. And it's pretty easy to do, just a small simple procedure, and it really improves your skin texture or your under eye circles as well.
Awesome. Can that be mixed with filler?
Yes, ma'am, it sure can. And when you mix it with filler, it really helps to stimulate your own collagen and fill in those areas where you've maybe had some bone loss with aging or some loss of the fat pads in your face due to aging, which we all have. So we can definitely do that too.
Awesome.
Yeah.
Well, how did you become an employee or staff here at Inspirations Med Spa?
So I was a patient here. I worked a very long time at one of the hospitals here in town, and I was a patient here, and I've always kind of been interested. And so I was just chatting with Stacy one day and asked if they would possibly consider having another injector here, and they were interested. So we talked, and here I am, and
Yay.
I love it.
And we love you.
Yeah,
All
good.
right.
That works out good.
It does.
Yeah.
All right. Thank you, Heather.
Yeah, you're
We're
welcome.
going to move on now to, there's Darla, the fabulous Darla, master injector Darla. But I do want to show you, before we go in, our fabulous cooler. We got juice, we got LaCroix, we got water, we got coffee. And we've got Darla. And we've got Darla. What do we got in here, Darla?
Come on in. This is where I work my magic. I do fillers. I do the toxins like Heather. I also do threads and biostimulators. I think that covers everything that I do. So threads are actually similar to a suture material. It's a polydioxanone, and when it's placed under the skin, it dissolves over time and it's replaced with collagen. So it's good for like fine lines around the mouth. It's good. We can do a brow lift with it. We can lift the cheeks. We can pull back the jawline. We can kind of tighten this area. We can do it in the neck. We can do it in the chest. They can actually be used just about anywhere on your body because it's suture material and it's absorbed. It takes about 3 months to see results with it. but it's fantastic. It takes about 3 treatments with it, so it's not a one and done kind of thing. Little bit of swelling with it, high risk of bruising with this procedure, so you definitely don't want to have anything scheduled, anything important for 2 to 3 weeks after having this done. I also do the fillers here. My favorite filler is the Teoxane line, and it's the RHA fillers. They are kind of the most natural of the fillers. They have long chains of hyaluronic acid, so they move with you when you move. So they're very elastic, dynamic types of fillers. There's 3 different levels of viscosity with them, so depending on what you're coming in for, I choose whatever level that we need for what you're having treated. My absolute favorite thing to do, though, is the lips. I use Versa Lips for the lips. I just love it. You get instant results with it. People are always pleased. I do sculpting and painting, and I look at the face kind of like an artist would, and I want everything to be proportional. So with any of the treatments that I do for you, I'm going to try to keep you in proportion always. I don't like to do the really big lips, the big cheeks. If you want something like that, this is not the place for you to come. But if you want to have a provider that's going to tell you when you need to stop, that's me.
That's true.
I am not going to take you there. Yeah, you'll need to go someplace else. I end up fixing a lot of people that have gone other places and had too much put in, and it doesn't look normal. It doesn't look natural. Our main goal here is always to keep you very natural looking.
We want you to look fresh, not fake.
Yes,
Yeah.
not fake at all. So this is kind of a little diagram here that shows all the places, like for Heather, where you can use the toxins. A lot of people don't realize the lower face areas that you can use the toxins in. So like the masseters, if you grind your teeth or have TMJ, this really helps. But not only does it help with grinding the teeth when we treat the masseters, that also thins the face. So if you're a woman and you feel like you have some large muscles in this area, we can treat those, and it really does thin the face in that area. Yeah, that's
Awesome.
I love this little saying here. If you think it's expensive to be injected by an expert, wait until you're injected by an amateur. And that is so true. You want to make sure that you're going to somebody who has the proper training and knows what they're doing, is familiar with anatomy. Because, fillers, there's a lot that can go wrong. So you want to make sure that you're going to someone who knows what they're doing. I've been doing this for 17 years.
And do you ever have to fix somebody else's work?
I fix other people's work all the time, either people moving here from other states. Sometimes it's just somebody coming to visit a family member, and the family member talks about me, so they come in and see me. I see many from some of the other places from around here. I would have to say mostly it's the lips. People mess up on the lips. It's either the lips get real lumpy, they're using the wrong product in the lips, they're using the wrong procedure, they haven't been adequately trained in what they're doing. So if I do have to fix something on you, I use a substance that dissolves the hyaluronic acid. If you come in to see me and you've been someplace else, especially in the lips, I'm going to dissolve your filler before I do anything else. So I'm not going to work over somebody else's work. I don't know what they've put in there. I don't know how much they've put in there. I don't know how long you've had it in there. So I'm going to dissolve it and take it out and start from scratch. Because then you have my lips.
Not your lips. But your lips
Lips
are
by Darla.
You have beautiful lips. Who did your lips, Darla?
Heather actually did my lips.
Did she?
Yeah, usually I did my own. But now
Yes.
that I have Heather, She did my lips, and she did a fantastic job.
Do you like own this place or something?
A little bit.
A little bit.
Little bit. Yes. This is my passion. I love this. And I have a fantastic staff here. I have a fantastic partner. Just couldn't ask for anything more. This is what I want to do until I retire, hopefully soon.
We all know that's not going to happen.
Yeah.
But
I'm
yeah.
kind of a control freak a little bit, and I just like being here.
And we love you here too. So couldn't ask for better. All right, out of Darla's room, we're going to head in and check out the laser room. Oh, somebody's having fun.
All right. Hi, guys. I'm Casey. I'm the spa manager and certified laser tech. And I'm going to talk to you guys a little bit about some of the laser treatments that we offer here. This is our laser. This is a BBL laser. We do so many different types of laser treatments. Our most popular treatment that we offer is probably laser hair removal. We do laser hair removal all over the body, head to toe. It is safe for all skin types, men and women. It is virtually painless and it's very quick. We do the most common areas where we do laser hair removal are underarms and lip and chin. We also do a lot of legs for men. We do chest and back both. And it normally takes about 6 to 8 treatments until you see no regrowth. And that's something that's really exciting because then you won't have to shave anymore.
Awesome. Tell me about the BBL process. The Forever Young
BBL
is probably our most popular treatment, aside from laser hair. What does that do? What does it treat? What you got there?
So Forever Young BBL is probably my favorite treatment to do. It kind of treats every patient's face as a canvas, and it treats for, we say, any visible signs of aging. So it treats for sun damage, any age spots, pigmentation. So if you have any light browns, dark browns, those pigments can be cleared up with the laser. In the same treatment process, it also treats for red. So if you have any redness that is caused by rosacea or broken capillaries, just prominent blood vessels. And then also it is going to treat for any surface issues that are kind of fine lines and wrinkles, large pores, because anytime we put that heat and energy into your skin, it helps to stimulate your body's natural collagen response. So it really just kind of tightens and brightens is what we say that the procedure does.
So what's the difference between BBL Forever Young and BBL Forever Young Plus?
BBL Forever Young Plus, this is a nice graphic right here. This is another service that we do with this laser called Skin Tight. I don't know if you guys can see, but what this does is it tightens the skin by producing basically the maximum collagen response that we can get from the body. And it does that. It's not an uncomfortable procedure. It just feels very, very warm. And we can do that procedure anywhere on the body, but we do offer Forever Young BBL Plus, which does all of the things I just talked about, but it also does the skin tight. We add the skin tight as the very last step, and it does skin tightening on the neck and lower half of the face along the jawline. We can also do that around the mouth and under the eyes.
Awesome. And what about acne? What do we do with acne patients? Is there a laser treatment that can help them?
Yeah, we also have a procedure called BBL Forever Clear. That one treats acne. So we use kind of similar settings with the BBL Forever Young that target some of the red areas, but then also there are additional settings on there that can target the bacteria that causes acne, and we can kill that bacteria and get rid of it. So it will help to heal any active blemishes and any redness, but then also that treatment will help prevent the acne from returning.
Awesome. So we've got a lot of things going on in this room. What about the halo? What can you tell me about the halo?
So I don't do the halo. It is a more invasive laser technique. So it actually breaks through the surface of your skin. It is a resurfacing laser. So that one more causes more trauma. It has more downtime. That one is more to treat surface imperfections. So if you have some scarring or things that can't be treated using traditional BBL, because that one doesn't break the surface of the skin, that one is more to promote a new skin growth.
Oh, look who I found.
Darla.
It's Darla. Darla, what can you tell us about the halo?
I can tell you that the halo is one of the procedures that I do sometimes. The halo is actually a hybrid laser. It is 2 lasers in one that causes, like she was saying, a lot of heat under the skin, so it causes tissue coagulation, and that helps with stimulating collagen. But then it's also got an ablative laser in it, so it does actually make the tiny columns of damage in the skin. Your body sends up its white blood cells. It sends up proteins to help to heal everything that's going on. So you get that collagen and elastin stimulation, but it will also break down scar tissue. It will treat stretch marks. It helps with the reds and the kind of scar tissue in the stretch marks. It does have a little bit of downtime. You're going to be red and really warm the day that you have it done. It's hot. It's going to be like the worst sunburn you've ever had. The next day, the redness is kind of gone. You still got some swelling. And then you're going to start seeing what's called mens, which is the dead skin cells and all of the just kind of crap coming out of your skin to the surface and slouging off. And it literally feels like sandpaper on your skin. And that's there for a couple of days. We do tell you, do not pick at that. Don't scratch at it. Let it come off by itself. You can use a washcloth to just kind of help it along. We give you products to use with any of our procedures that we do here. If you buy a package, it's free. We send you home with a kit of products that we would like for you to use to help maintain your results after you leave here. But yeah, this is really good for, it brightens your skin. It makes you much younger looking. It helps fine lines and wrinkles. And people, when they have this done, it's just amazing. They just really love their skin after having it done. Takes about, I don't know, a month to see total results, but it's going to last for a while. You can do this once a year. And what we do is we have you do this once a year and then do the BBL for every young, kind of in between, like every 6 months, 3 months, to maintain your results, get rid of any damage that you're getting when you're out in the sun. But yeah, this is a workhorse here. This will do a lot. And any of these you can use anywhere on the body. So it's not just the face. We can treat the chest with it, the BBLs. You can also do the skin tightening on your abdomen, your legs. We just had somebody in today asking about the legs. But yeah, it's a Cyton machine and it's a workhorse.
Darla mentioned with the halo, there is a downtime because you have to allow time for that skin to heal. With the other treatments that we do with this laser that I was talking about, the BBL, if you were doing those for maintenance between your halos, there's a much less downtime for that. What that looks like is any pigments that you have that are being treated, they darken. And then it takes about a week. Some people take about 2 to heal. Those will be a little bit darker and then they'll either kind of flake off or just fade away. But because that is a non-invasive laser, you can apply a full face of makeup immediately after if you are a little bit red or if the browns are too dark for your liking. The acne, the BBL Forever Clear is similar. You may just be red for an hour or so. It shouldn't cause any issue. And then with the laser hair removal, there's no downtime after that either.
Awesome. What would you say to somebody who's hesitant about getting laser hair removal?
I would tell them just to try it. There are a lot of people who are hesitant about it because they have had previous experiences with laser hair removal, maybe 10 years ago, or maybe with a different type of laser technology. And I think that even if you just tried it one time, you would see that it's not nearly as painful as it was on other devices. And then also that it's much more effective than it ever was before. So we always tell people this is the best device around, and it's fast. It's so fast. The treatment we can do underarms or lip and chin or something like that, a small area, in less than a minute. So it's worth it.
All right. And Casey, how long have you been with Inspirations?
Well, we're about to celebrate our anniversary, which is 3 years in March, and I came 6 months after you guys opened. So that'll be 2.5 years for me.
All right. And what do you love about
What
Inspirations?
do I love about Inspirations? I love that every single day is something new. I don't think personally I would thrive at a job where it was routine doing the same exact thing every single day. So I love that I can come in, and even if I'm doing the same procedures day after day, it's with different people. It's completely different. Even if that's why I was saying I love to do BBL so much, because I can have 3 BBLs back to back to back in a row, and it's on 3 different faces, and it's a completely different treatment every single time.
And what is your position here?
I'm the spa manager. I'm also a certified laser technician.
And what treatments do you do all
So,
day?
I do all of these laser treatments that we've been talking about besides the halo. Besides that, I also do a couple of different medical grade facials that we offer, dermaplaning. We have a couple of different non-invasive body contouring methods. We have M-Sculpt Neo, and we have CryoSkin, and yeah, that's about it.
Yeah.
Oh yeah, lashes and brows. We do
Yeah.
offer some of those things.
All right. Well, it was lovely seeing you in the laser room.
See me again in the body contouring room.
All right. Looking forward to it. Now we are going to move back out, and we are going to come down the hall here, and we are going to be in the facial room where, oh, there's Chelsea. Hi, Chelsea.
How's it going?
It's great. Who are you?
I am Chelsea. I'm an esthetician, a laser tech, and the front office manager here at Inspirations Med Spa.
What room are we in?
We are in the facial room. So this is the home of the Diamond Glow. We do a lot of dermaplaning in here. All of our facials, therapeutic and medical, are done in this room for the most part.
Tell me about a facial. What do you do? What is a facial?
So a facial is customizable to you. So the Diamond Glow facial is a medical mechanical grade facial. Uses this machine over here that exfoliates, extracts, and infuses a serum, all 3 at the same time. Everything collects in a little jar. You get to analyze your skin. It's great. I do a couple custom facials, so a mini and a full. That's just customized to you. So we go over your skin type, your skin concerns, and choose treatment masks and things like that based on you. And we do extractions and stuff like that. My current favorite is the hydrogelly facial. So that uses one of these masks on the wall here. It's a powder we just mix with water, but it sets up and gets kind of rubbery almost, and it works as a vacuum while it's setting up to infuse all those nutrients into your skin. Leaves you nice and glowy when you leave, nice dewy skin. So that's my new favorite. Been using a lot of the brightening complex in the winter. It helps with sunspots and things like that.
So what one's your favorite right now? If you had to pick, which one of these?
The brightening complex is great. I use the LED mask a lot with our LED facials. Those help to treat a couple different things. It has a blue light setting to treat acne. So that helps to hydrate your skin while we're treating that. We also have a red light setting that helps to treat fine lines and wrinkles and helps to stimulate that collagen. So that helps to keep you nice and hydrated while you're under that lamp.
All right. What does the LED do?
The LED mask?
The LED. What
So
is
the
the
LED is a almost looks like a little dome we put on you, and it has LED lights in it. So there's a red light and a blue light, and they help to treat fine lines. The red light does. The blue light helps to treat acne by killing the bacteria on your skin. There's also a setting for aches and pains, which is nice. So we can help after some of the more invasive treatments to help kind of calm your skin down and take care of bruising and things like that.
Awesome. So I want a facial. Walk me through the process. I come in and I lay down on this bed. And what do you do?
So first I'm going to double cleanse your skin. We'll kind of take a look at it under. I have a little magnifying glass. We'll kind of go over your concerns and what I see, and I go off of that. We usually do some steam and extractions. Most everyone could benefit from a little bit of an extraction, even if it's just your nose. And then we do treatment masks. So that's where it differentiates the mini from the full facial. We'll do 1 treatment mask for the mini, 2 for the full. And then I finish with customizable treatment serums just based on what your skin concerns are.
Okay. And then the Diamond Glow, that one is personally my favorite facial. I love being able to see the jar at the end. This is filled with your face water and serum and
Great.
gross junk that gets pulled out. It is fabulous. It's disgusting, but it is so satisfying to see. I mean, when I do one, I like seeing what I pulled out of somebody's face. And when I get one done, I can't believe how much grossness is in my face. This is also the room where you do lash lift and tints. Is that correct?
It is. Yep.
And walk me through that process.
So lash lift and tints is a process that essentially perms your hairs into place. So when you do your lashes, we put a little silicone rod on your lid and we curl your lashes over that and then perm them in place. So it's like using your eyelash curler every day, but you don't have to. And then we tint them dark so you don't have to wear mascara every day. And then the brow lamination is a similar process. It's perming your brow hairs into place. So we can make your brows look fuller, shape them more, and then we tint those as well. So you don't have to fill them in.
Wow, that sounds fabulous.
It's pretty nice.
And how long does that last?
About 4 to 6 weeks.
All right. Well, thank you, Chelsea.
Thank you.
We are going to go check out the body contouring room next. A little walk down the hall here. And there's Casey. Hey, Case.
Hey.
What you doing in here?
I am just going to show you guys our body contouring room. I'm not going to go too in depth in here today because there are going to be some live demos later this week, right?
Yes, there are.
Both. This is our Psycho body scanner, and then this is our M-Sculpt Neo. So you guys are going to see those more this week. But the Psycho body scanner is our newest service, actually, that we offer. And what it does, Stacey can show you this platform here. You stand on it, and then it kind of spins you around in a circle. And this tower will create a 3D image of your body as you are going around. And we can use that. It creates a ton of measurements all over your body. It gives you body fat percentages, weight, all of these different metrics that we then can compare when we do routine scans. So whether you're pairing that with a body contouring service here, or whether you're just curious on your own or doing something at home that you want to track your progress for, we can do a different scan. We could do one every single day and compare it to the one from before. I don't recommend that, but we could compare them, and it's really cool to see.
You wouldn't recommend that?
I mean, I wouldn't do it every day, but once a week, once a month.
All right. So this is the M-Sculpt Neo.
This is.
What is the difference between M-Sculpt Neo and M-Sculpt?
So M-Sculpt Classic is a machine that uses, it creates an electromagnetic field. This paddle here produces an electromagnetic field, and we can use this now on any area of the body almost. It is most commonly used on the abdomen, but what that electromagnetic field does is simulates a muscle contraction. So what this does is, if you were comparing it to like doing sit-ups at the gym, if you do a 30-minute session on your abdomen, it's a muscle contraction equivalent of doing 20,000 sit-ups in 30 minutes. So that is the M-Sculpt part. That is the muscle contraction and building muscle part of it. We have the M-Sculpt Neo, which is newer and it has more advanced technology. It adds radio frequency heat onto the treatment, which that heat can target the fat that is unwanted in those areas and heat the fat cells up to a temperature where they can't survive anymore. So now we are both sculpting the muscle and then also decreasing the fat in that area.
That sounds fabulous.
Yeah.
Who doesn't need that?
Everyone needs
Really. All right. So there are 2 beds here.
There are.
Why are there 2 beds here?
There are 2 beds here because there are some areas of the body so we have 2 paddles. There are some areas of the body where you use both of those paddles. You can also do it on the glutes. That's another one of the popular areas. Other areas that it's indicated for would be legs. So you can basically do all around: inner thighs, outer thighs, fronts and backs. But when we are doing abdomens, typically we use one paddle. There are instances where we can use two, but if you are just using one paddle on each individual, two people can be doing the machine at one time. So we do offer a package called Buddy Sculpting, and that means that you and your friend, or you and your husband, or you and your mom could come in and you could have a discount if you did your 4 series package at the same time and you came in and you did it together.
Well, that sounds fun.
Yeah.
Have you ever buddy sculpt?
I have.
Yeah.
I think I'm going to buddy sculpt with Stacey tomorrow.
I think that's happening. All right. And the last thing that we've got in this room is
This is cryo skin. So this is another non-invasive body sculpting technique. This one uses freezing. So it uses cold temperatures. So this one decreases the temperature of your fat cells to a temperature where they can't survive anymore. So this one doesn't have the muscle contraction component, but it does have that decrease in fat. So we used to use this for all areas of the body, and we still can. It can be used. Common areas where we use this are arms and then also abdomen. But what we most commonly use this for now, because we have the Emsculpt Neo for the other body parts, are we do this a lot as a facial. So we do this a lot to freeze the fat that is just under the chin and kind of sculpt the jawline and give a little bit of a lift. That is the most popular thing that we do with this device now.
awesome. And is there a special for Emsculpt coming up?
There is a special for Emsculpt coming up. So a typical series of Emsculpt, if you were to buy a package, normally we recommend a series of 4 treatments, and we are doing, actually starting tomorrow, we might give it today if you called during the day today, but you didn't. So tomorrow through Friday, we are doing 6 Emsculpt treatments for the price of your normal 4 package. So you get 2 treatments free.
Well,
That's half a package.
that's pretty good.
Yeah.
What about this guy?
This
What about
guy,
that Staiku
yeah,
thing?
so when you do an Emsculpt package, you get a Staiku body scan included every single time you come in. So we'll do it as a baseline the first time you come in. We'll do it for progress every single week. And then 8 to 12 weeks out, we will do a recheck where we'll do another body scan after you've completed all of your Emsculpt treatments.
That's amazing.
And those all get sent right to your email so you can see the results.
Awesome.
Can I do a body scan dressed like this?
Can you do a body scan dressed like that? No, you can't.
Well,
It's
you
too late.
you
It's
could,
too late.
you could, but
But it won't give you accurate measurements. So the body scan, you can do clothes. You just have to be in tight fitting clothing. So for men, that usually looks like boxers are fine. For women, normally leggings and a sports bra are fine too. We also have the option to, if you were wearing loose fitting clothing, but you still wanted to do your scan, we can set up the scan to auto go so that we can leave the room. And if you need to be in your bra and underwear when you do the scan, then that's possible as well.
awesome. Thank you, Casey.
You're welcome.
Next up is our last treatment room here. And oh, there's Allison again. Allison, what are we doing in here?
We have 2 things. We have a lymphatic drainage bodysuit that we have here in the corner. And this is usually a 30-minute treatment that you relax in for 30 minutes. And it triggers the lymphatic system to drain. It helps with removing toxins and any dead fat cells that you have from the Emsculpt Neo. So we pair this with those packages as well. And it also helps with swelling.
Awesome. What would you say it feels like?
A gentle massage. It's very relaxing.
Yes. And how long is that?
30 minutes.
30 minutes. Okay. Now you've got this giant chair in the
Yeah,
corner.
So this is our Emsella, and it's our Kegel throne.
The Kegel throne it is. We will have a demo of this tomorrow. Yes. And you
tomorrow.
are running that demo.
Yeah.
Yes. So tell me about the Kegel throne here.
So this is a non-invasive incontinence treatment. And so it strengthens the pelvic floor. So you're doing 12,000 Kegels in 28 minutes. And we recommend 6 treatments twice a week. And you just have to sit on the chair. You can be fully clothed. And you can bring your iPad, look at your phone.
pretty easy.
Yeah.
Yeah. Is it uncomfortable?
Nope, it's not uncomfortable. It's just stimulating those pelvic floor muscles.
So what does it feel
It's,
like?
A vibrating sensation.
Good. But you said it doesn't hurt
No.
and it's 28 minutes.
Yep.
And what type of incontinence does it work for?
All of them.
All of them.
Yep.
That's amazing.
Yeah.
Great. All right.
And then it also does sexual enhancement too.
Is that an extra charge?
Nope. It's included.
It's included. Excellent. All right. So yeah, that works by increasing the blood flow to the area for that. So there's 2 different settings that we use on that. And it is really, we've had quite a few people come through and say that it's very comfortable. It really does help. We've had people say that it helps after just the single treatment. So that's exciting, especially for moms that have big-headed babies. We all know that that can be an issue. So yeah, we'll do a demo of that tomorrow around 2. I don't know what time it is. We'll look and see what time it is. But now let's go back to the lobby and answer some of your questions. This is a great time to send in all of those questions that you might have. We're gonna head, oh, look, they're all hanging out, having fun out here without me. So rude. All right, so let's start. Let's see, what do we got here? Casey, what's your favorite treatment that you've had done and why?
Had done. Oh wow. Well, I love having my lips done. I'll never go back. You'll never go back to having no lips after you get lip filler. And once you get lip filler and you experience the swelling phase of lip filler, then you'll want more lip filler after that. So that's my favorite, like kind of bigger treatment, but routinely I love dermaplanings and diamond glows. Those pair together and those keep your face so smooth and so clean.
And I'm just noticing there's a man behind your head.
That's Dr. Kirchhoff.
That's Dr. Kirchhoff. Who's Dr. Kirchhoff?
Dr. Kirchhoff is our medical director. He does not practice out of our office, but he's in and out from time and time again, and he sees everything that we do here, and he oversees everything that we do, all of our trainings, all of our charting, all of our new patients. He will go over all of your information. So he's kind of a ghost, but he sees everything we do.
Awesome.
Behind the curtain.
Yeah.
All right, Chelsea, your favorite treatment and why?
Favorite treatment is probably laser hair removal. Close second is also my lips. But laser hair removal is amazing. Saves you so much time. I have a toddler. I don't have time to be in the shower for hours shaving. So it's amazing.
Darla,
Yes.
favorite treatment and why?
I'm kind of like Casey. I love the dermaplaning and the facials. And Chelsea is amazing when you lay down and let her start working on your face. It just, I mean, she does have people fall asleep and snore. It's fantastic. Botox or any of our toxins, smooth. You can't look mean at people anymore. No more resting bitch face. Have a little bit of it there and it raises the corners of your mouth. So that's another favorite of mine. I have a few.
Yeah. Heather.
My favorite is the BBL laser treatment. It helps to correct pigmentation on your face that you have from years of sun damage, helps stimulate collagen, fill in fine lines. So that is the best treatment. My second is lips.
Lips.
Sure.
Awesome. Allison, have you had any of these treatments
I
done?
have not had any of them done.
No. What is your favorite and why?
I really like the Sculpt, and I like to do it my backside.
Yeah. Have you noticed an improvement?
I have, yes, it's strengthened the muscle so that when I do squats at the gym now, I actually can engage that muscle.
Oh, yeah. So you have a booty now.
I sure do.
Awesome. And I'm going to do a quick selfie here. Okay, so mine is, I don't know, I do them all. Honestly, I love every single thing.
you like BBL? Halo.
I did the Halo and the BBL combo recently, and I will say that that's probably the biggest change my skin has seen in a very long time. It I've got a video. You guys should watch it. It's my progress through it all. My face, like my pores were smaller, the fine lines were magically erased. I love my filler. I love my toxin. I do the Jeuveau, and there might be a lot of it in my face. But I get everything done. I grind my teeth, so I get it in my masseters. I don't like looking like I'm always angry, like Darla said. So I don't anymore. I'm really surprised right now. Can you tell? No, you can't, because I'm really mad. No, you can't tell either. So it's fine with me. I don't care that I can't make those faces. I just do all of the things, and I love them all. The laser hair removal, yes. The dermaplaning, yes. All of the things. BBL, I got some pigment that we've been working on. It's amazing. All right, next question, and enough of my face. Let's see. Turn around, camera. Next question is for Darla. Darla, how long have you been in this industry?
Oh God. I started back in 2006. I used to work at Family Doctors of Vicksburg I was the office manager there for quite a while. I was there for a total of 25 years. In 2006, I started laser there. Did it by myself for till about 2017, where I had one of the medical assistants there that was helping me for a while, and then she decided she didn't like doing it anymore. And then along came Stacy.
That's me.
In 2016.
16. It was 16. Yep.
And Stacy was medical assistant. She was also working with the doctors there. She started working with me and fell in love with both me
with
and
Darla.
the procedures. And then we were bought out by another company, and we decided that we'd kind of like to try it on our own. So in end of 2018, we made the leap. We went out on our own. We got this building here. Stacy's keen eye for interior decorating. She did most of what's in here. I'm the financial mind here. Stacy does all of the marketing and stuff. But yeah, we opened this in 2018. So this month is actually kind of our 3-year anniversary. We actually started seeing patients in January of 2019, but we were just seeing some of our regular patients that we had already been seeing. We wanted to make sure that everything worked. All of the procedures did what they were supposed to. We worked on each other, on family. And then finally in March, we opened it to the public, and we have grown. I think our malpractice carrier said 248%.
Yes.
Since
Yep.
then. So
not that we have any malpractice issues.
Yeah,
They-
we had to build this room special for Heather when she came to work with us, because we had no place to put her. So we have really outgrown this building. We are looking at the little plot of land across our parking lot there at possibly building there in the spring. So if you know
That's
any
awesome.
contractors, go ahead.
Allison,
Yes.
Let us know.
why did you come to Inspirations?
Well, I was a former patient here, and I just love the atmosphere, and I enjoyed the treatments. I was seeing results, and so I applied.
And what is your favorite thing about working here?
Working with you.
I told her to say that. But she wins. That's good. Yeah, that was our favorite
And you
there.
didn't pay her to do that.
I did not pay her, but I do pay her. So I guess that kind
She
of
is on the
counts. Yeah. Casey,
Yes.
what are you in school for right now?
Well, it's not really official, but I am finishing the last couple of classes right now that I need in order to go back to school to obtain a nursing degree, so that I can do all of the things that these lovely ladies talk to you about, Heather and Darla, all of the injectables and things that they do. Yeah.
Awesome. Chelsea, your turn.
I'm going back to school too. It's been a very long time. I'm going back to become a medical assistant so I can do some more procedures here, like microneedling and the halo, a little more invasive stuff.
Awesome. All right. And Heather, are you going back to school?
No, absolutely not. I have a master's. Not an option.
Yeah.
Heather does all of our consultations. So
I
if you
do.
come in as a new patient, you're going to see Heather.
Yes. And I would love to see you and talk about what you want and you need.
Awesome. Well, I think that's all for our questions today. Let's just chat really quick about all of our specials coming up. So this week, starting tomorrow, we're doing the M-Sculpt and M-Cella treatments. So that's going to be buy a package and you get 2 additional bonus treatments for free. Remember, the M-Sculpt comes with the, I'm going to just mess with my hair as I'm talking. Okay. The M-Sculpt comes with the Staiku body scanning, and it also comes with the pressotherapy lymphatic drainage, which is awesome. Like Allison said, it's really relaxing and you'll just fall asleep most of the time. I have to try to fight myself to stay awake because it is really relaxing. Next week is our buy 3, get 1 free lip filler regular filler special. You can add a lip filler in there too if you want, with Darla. Those are, you have to purchase those next week, and they have to be used by the end of the month. So typically 1 syringe for your face is not going to do what you want it to do. So full correction is 3, 4, 5, 6 syringes. So we want you to see what full correction can do for you. We want you to leave happy and not be like, I think I see something. We want you to see the full results. So the buy 3, get 1 free is a great opportunity for that. The following week, I believe is it's PRX treatment. We didn't even talk about PRX. Hold one moment. We're going to go back to Heather so she can tell us a little bit about PRX. Heather, what is PRX?
So PRX is our newest reverse chemical peel. So as you know, chemical peels usually peel about a week after, for a week. PRX actually works down deep into the layers and helps to tighten up those fine lines, helps with the texture of your skin, pigmentation. Yeah, so we can do that. You need to get 4 treatments, PRX, and you can come and see any of us for that.
Awesome. So PRX has been a really big popular treatment right now because it does work for just about anything. It was actually developed for kids with scarring, and it helped promote the healing for them. And it was just a game changer. Here are a couple of quick, I stopped my video and let's switch that around. Wrong button, sorry. Before and afters there on their brochure. We've had a lot of clients getting it recently, and they're very happy with that treatment. You can see a difference right away with the toning and the tightening, so that's really cool. The other we do recommend a series of 4, series of 6. If you buy a package of those, you get a bonus treatment with that, which it's like a $250 value. So it's a big savings for you for that. The following week is our facial week. Basically, we're offering any facial that you schedule that week, you are going to get a free dermaplaning, a free hydrogelly mask, or an LED treatment, your choice, just complimentary with any scheduled facial that week. And then the last week is our PRF special. So if you were thinking that sounded interesting, that would be the week that you would want to schedule. You're going to get $50 off as an injectable treatment or a microneedling treatment with PRF. So that can be scheduled at any time to that week. And that is, I think, all of our specials. It's going to be a crazy week or a crazy month for March Madness, but we are so glad that you stuck around and watched our Q&A session and our tour, and hope to see you all soon.
Thanks. Bye.
Bye.